Welcome to the Everything Cancer podcast. This podcast is intended for survivors, those who love them, healthcare providers, and cancer support organizations. Our guests offer insight into the honest survivor experience, how challenges are met head-on, and where blessings are discovered. We cover effective self-advocacy on the bumpy road of cancer survivorship from the moment of diagnosis on. We talk about rekindling intimacy when cancer has changed your world. We are given behind the scenes insight into cancer care because understanding it better empowers you to advocate for yourself more effectively. We hear from leaders of cancer support organizations about their resources and how to access them or those like them. The Everything Cancer podcast welcomes survivors who would like to share their journey and how they have met their challenges, providers who would like to share their empowering insight, and leaders of cancer support organizations who would like to share their stories and resources. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please note the information shared on the Everything Cancer podcast is not intended as medical advice. Please always consult with your healthcare team. The staff at Everything Cancer podcast will not answer individual healthcare concern questions. Thank you for joining us, and we hope that you enjoy this episode and find it useful. Please do share it with other people if you think they'll benefit from it, and rate us on your favorite podcast platform. Thanks and take care.
I was a single mom of my triplets when they were 3 years old. I was having two offices and trying to keep all the balls in the air.
If you would like to support the Everything Cancer podcast, there are links in the show notes to our Patreon page and our website. Welcome to the Everything Cancer podcast, the empowering extra-large suitcase of the cancer journey. I'm your host, Jill, longtime oncology certified nurse and cancer support group facilitator. This show is designed for survivors and those who love them, and to offer providers insight and fresh perspectives. The information shared on this podcast is not intended to be used for medical advice. For any healthcare concerns you have, please consult with your healthcare team. The staff at Everything Cancer podcast will not be answering individual healthcare concern questions. We have with us a guest, Cynthia Aks, who I am really thrilled to have here. She is interesting, caring, and is full of wonderful, helpful information. Cynthia is a retired integrative breast surgical oncologist who now is a certified yoga therapist, certified energy healer, an integrative health coach, and a certified oncology nutrition counselor. And just because of her background with being an integrative surgical breast oncologist, she really gets it with what people go through, and is very passionate about bringing integrative health into the survivorship experience and helping people have a higher quality of life and feel better through treatment and through maintenance therapy and on the rest of their journey. Welcome, Cynthia.
Thank you very much, Jill, for the opportunity to speak with your audience.
I'm so glad to have you here. So you wanted to talk with us today about the nutrition aspect of things.
Nutritional therapy is a way to use nutrients in order to promote health and healing. And nutrition is such a key element to health and wellness. If you think about it, we are what we eat, and we are what we eat eats. So from an energy perspective, everything is energy. Life is energy. Our bodies, our thoughts, our emotion, our spirit, the planet, the universe, it's all energy. And so when we look from a nutritional standpoint, there are different levels of energy in food. The highest level of energy is within plants. Plants take the energy from the sun and utilize that with the nutrients in the soil and the water to grow and produce. The next level of energy is that of the animals that we eat. So whether it's red meats or poultry or fish or their eggs, yes, they eat the plants, but it's the next level down. And then the lowest level is that of processed food, or what I referred to as dead food. It really has lost so
Right.
much energy and nutritional value. So I don't think people stop to think about that perspective. So if their diet is predominantly processed food, a lot of animal products, then that's the quality and quantity of energy that they're intaking to give our cells the building blocks they need in order to function properly. In the United States, the standard American diet, also referred to as the SAD diet appropriately, is predominantly processed food laden with lots of sugar and salt and high in carbohydrates, high in fats, and really not so much vegetables and fruits, like fresh vegetables and fruits. And
Mm-hmm.
also, our diet, the way it's grown, like compared to 100 years ago, our nutrients that are grown are 40% less nutrient dense than they were 100 years ago. They're also full of chemicals. Like we have
Yeah.
hundreds of thousands of chemicals in our world, in our environment. And these chemicals on our produce are things like pesticides, fungicides, herbicides that get into the matrix of the food. Even organic food has about 30% of these chemicals. And our bodies, evolutionarily, our genes, are not yet designed to break down and eliminate these toxins from our body. So, all of these aspects of our food, our nutrients, contribute to the development of ill health and dis-ease. From a cancer perspective, a cancer cell is a cell that was once normal in the way it behaved, the way it functioned. And typically, there's all sorts of genetic, chemical mechanisms that keep a cell on the right path. There's a cell cycle. Part of that cell cycle is multiplying, dividing, growing, taking a pause in growth, and then being programmed to die off. Cells have
Mm-hmm.
a specific lifespan, and in different systems, cells of the body have a different designated lifespan. But what happens with cancer cells is there's many different characteristics that cause a normal cell to undergo that malignant transformation and to become immortal. So they don't die off and they proliferate. So they evade normal growth suppressor genes. So if there's a abnormal suppressor gene, such as a BRCA1 and 2, many of your audience may be familiar with those kind of genes, or a TP53, it evades those suppressor genes. So suppressor genes help to control regulatory growth. So that could be a characteristic that's abnormal. Or chronic inflammation. What happens with chronic inflammation is it causes DNA damage, it suppresses the immune system, it promotes tumor growth, it can contribute to the development of the cancer cell being able to develop its own blood supply. That's called angiogenesis. And then this allows a tumor cell to start invading other normal cells nearby and strip those cells of nutrients and then spread to other areas called metastasis. And this chronic inflammation creates free radicals, which cause a condition called oxidative stress, which contributes to more DNA damage. And there's this vicious cycle. So we can use nutrients to target some of these characteristics. As an example, there are foods that are anti-inflammatory. So foods that specifically try to control that activation of what we call the inflammatory cascade. There's specific foods that do that, such as omega-3 foods or foods that have salicylates in them. Salicylate is what we find in aspirin. These can be things like peppers, tomatoes, wintergreen, or even something called white willow bark. Flavonoids are anti-inflammatory. These help to reduce a compound called COX-2. I know this is getting a little esoteric, but it's part of that inflammatory cascades. Is one of the targets that we can use nutrients like, let's kind of halt that increase in COX-2 from this chronic inflammation. And there's lots of foods that do that, such as apples and onions and capers and berries. So there's a lot of opportunity to use nutrients to help not only during our cancer treatment to reduce the toxicity of some of the treatments, chemotherapy, radiation, even surgery, to increase the effectiveness of those drugs, or to help mitigate or manage side effects. So this is what nutritional therapy is all about. And then there's another aspect of nutritional therapy, and that's doing a deeper dive into understanding someone's bioindividuality. Like we are all different, even identical twins or multiples. I don't want to just say twins because I had triplets. Identical,
Wow.
but they weren't identical. Even identical siblings, though their inherited genetics are identical, there's so much bioindividuality. No person is ever the same. And so therefore you have to think about, well, it makes sense that one diet doesn't fit all. I like to say one diet fits none, because there's so much individuality. And even within the same person, sometimes one diet plan needs to change. It was interesting. I was looking at LinkedIn this morning, and there was an article that came out of the University of California, San Diego, looking at the microbiome. So the research about the microbiome, which is all the organisms that make us, that live in and on us, actually 10 times more microbial cells than human cells, believe it or not. Still kind of blows my mind away when I say that to people.
Yeah, that's crazy.
And then if you think about how many genes a single microbial cells have, we have 23,000 genes. It's just mind-blowing. But anyway, the research about the microbiome and how it interacts with the host, which is our human cells, is really exploding. This article talked about one of the reasons why there's been some difficulty in replicating results when they're testing microbiome is that they found at this lab in San Diego that the timing that they took the sample, the organisms varied depending on the timing of the day. So we have trillions of microbes, but they oscillate. And I just learned this. It's pretty fascinating. They oscillate. So some microbes are more active and robust at different times of the day.
So we're like walking around with all these microbes on us that live with us, that are part of our health.
Absolutely.
Wow. Okay.
And it's probably a little off the topic, but
it's not really.
I kind of feel intuitively that, well, we know that taking too many antibiotics in someone's life is very detrimental because it totally destroys our microbiome. And as we're learning how important that symbiotic relationship is between our microbiome and our human cells. But so I've always believed that, and I've never been a big prescriber of antibiotics, There definitely is a benefit to them. I'm not saying that pharmaceuticals aren't needed, but being very judicious in when they're needed. But also, probiotic supplements and, what's good, and don't take the same one forever. It's good to have diversity, but really better understanding what we truly need as an individual. And that, we don't have it all figured out, but we're getting better. But that's doing a deeper dive. So one of the ways that nutritional therapy can help is to look at nutrigenomics and nutrigenetics. So what are the various slight alterations in someone's genes, the genes that have to do with nutrient metabolism, and then better understanding that and supporting that, or correcting imbalances, which can cause dysregulation. A simple example of that, Jill, would be, common mutation. These subtle alterations, they have an abbreviation called SNPs. And SNP, SNP, stands for single nucleotide polymorphisms. And so a very common one that a lot of people have and don't know about is an enzyme. It's abbreviated MTHFR, which stands for a very long word called methotetrahydrofolate reductase. Say that fast 10 times. And so what this enzyme is very important for a biochemical process called methylation. And methylation is important for the health of our DNA. So I actually got tested years ago. This when I first started on this healing path to better understand bioindividuality. And a simple correct. So what this means is that people that have certain variations of the MTHFR gene, they don't methylate well. Their methylation process is impaired or altered. And so the gene I have reduces methylation 30 to 40%. So what do I do about it? Well, I take a supplement that's a methylated B-folate, or folate is B9.
And how did that change things for you?
Well, it gives the methylation system a little bit more methyl groups, methyl donors. A methyl group is 1 carbon and 3 hydrogens, so that pathway is more robust. It's not as impaired. So just simple little things, if we would just take the time to do the deeper dive to understand our individual uniqueness, where is there opportunity to make simple adjustments, whether that's looking more at our food choices. Okay, can I improve my biochemistry with just some easy peasy changes? Do I really benefit from a supplement? I think that people take supplements indiscriminately. Like, I can't tell you how many times people come into my office. I always tell them, bring in your meds, bring in your supplements, whatever you're taking, let me see them. I may not know what they all mean, but I can look it up. And I'll ask them, what are you taking this for? Oh, I don't know. I saw it on Facebook. It said it was good for me. Or my daughter told me it's good for my heart health, so I'm taking it. But what they may not appreciate is, number one, they may not need it. It may be contributing to an excess. So deficiencies or insufficiencies and deficiencies are not good, but also excess can be a problem. Just like we all know that exercise is good for the human body on a multitude of levels, but too little, also too much, can be detrimental. So really understanding what the issues are, what is important for that individual to start making changes to try to repair some imbalances, and not just indiscriminately take supplements. I'm a big proponent of food first, and then if needed to supplement as needed, and then reevaluate. because sometimes, if we just work on improving someone's dietary choices and their lifestyle habits, they eventually may not need the supplements. They eventually may need less of their medication or even get off some of their prescription medications.
Thank you for tuning into the Everything Cancer podcast. We appreciate you being here with us. If you are finding this episode useful, please share it with others that you think would benefit. And don't forget to rate us with your favorite podcast platform. Please check out the show notes for more information and more information about our guests, links to their websites, and any other resources they've shared. We aim to make it easy for you to connect and learn more about the valuable insights shared in each episode. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please stay tuned for a brief word from our sponsors, and then we'll be right back to our episode. Thank you so much. Do you have a dry mouth that distracts you with that nasty feeling and taste? H2 Ocean has your solution, literally and figuratively, with its sea salt healing rinse. It's made from salt from the Red Sea, and it has other minerals that are beneficial to you in it. It also has lysozyme enzyme, which is soothing to the inside of your mouth, and xylitol, which makes your mouth water. It's very mild in flavor, yet refreshing. Does not make you suck in your cheeks like often happens with other mouthwashes. And it stays with you. Other mouthwashes, they're gone in 10 or 15 minutes. This has stayed with me for a few hours now, and it's great. I plan on using it before every podcast episode to keep my mouth moist without taking distracting sips of tea and so on while I'm talking. The links to the H2 Ocean Sea Salt Healing Rinse will be in the show notes, and then a QR code also on the YouTube version of this podcast. It's excellent to help rinsing with chemo mouth or irritation in your mouth from radiation, but mouth sores and just general everyday use. I find it really pleasant and really helpful to use. I hope you do too. Thanks. I have read many places that oftentimes using the food that you eat to meet your needs is superior to using supplements in terms of getting what you need, as long as you're doing it in the right way, such as you're saying, in terms of quality.
But sometimes it's really difficult for people to do that. Like if you think about, yeah, we recommend that people eat daily, ideally 7 to 9 vegetables and fruits, more vegetable than fruit, because fruit does have a higher amount of sugar, glycemic index in it. But, for some people, it's hard to do that. It's hard to eat that much food. They may not be able to afford organic. So as I mentioned earlier, there's nutrient depletion in the soil. So even if we're eating all those good, healthy things, we don't know, is that enough? Or do I have an alteration in my genes that doesn't allow me to break down those foods or utilize those nutrients? It's trying to develop strategies and workarounds.
I think one of the things that people deal with a lot, no matter where they are on their journey, is fatigue. So let's say that someone comes to see you that deals with fatigue. What would your visit with them look like, Cynthia?
Oh, well, there's so many things to do to help with fatigue. One is actually exercise. So if
Uh-huh.
people are tired, they don't want to exercise, but studies show that, even starting out with just 5 minutes or get up and walk in your house
Mm-hmm.
or walk around the block, eventually it does eliminate fatigue, increases endorphins. But I usually encourage people to, like, first of all, look at your diet, look
Right.
at how much protein you're getting, look at, how hydrated you are. Sometimes just being dehydrated can create fatigue, and
Mm-hmm.
as well as a multitude of, other symptoms. You have a higher heart rate, the heart has to work harder, so that can make you fatigue. Look at your sleep. Many things can interfere with sleep. And so when you don't have good sleep, it does a lot of things. It
Right.
can create cortisol levels that are high, which can create mood disorders and fatigue and insulin resistance and weaken immune system and decrease in your white blood cells, your T cells. So, diet's very important, making sure that you have the right nutrient support.
So how would you go about like working with that person and looking at their balance and working with them and their diet, and so on, looking at that so that our audience can kind of relate to what you're saying?
From my perspective as an integrative healer, I like to take an initial visit and spend at least an hour with someone, getting to know every aspect about them as I can. I have a very lengthy intake questionnaire. What kind of support system they have, what kind of stresses they have, their previous history. That is all important because we are a culmination of everything past and present that we've done in our life. And then I tried to find, okay, when it comes to nutritional therapy, really understand their dietary choices and why, what's driving them. So, just trying to do that deep dive and understanding what they're eating and drinking, why, what their food cravings are. Another key thing is to get to know them is really how committed are they to make changes? Because I can tell you, Jill, I spent so many hours with a patient to try to empower, educate, motivate, inspire them to make changes in their life, and they just don't do it. Or they get really gung-ho and they try to change all these things at once, but that's not sustainable. It's just too overwhelming. And so with time, they started to slip back to their old patterns of being. So what I like to do is just kind of get a sense as to who they are and then help them see where there's opportunity to make changes, and then have them or work with them on how to prioritize those things and then pick one thing at a time. So taking baby steps, ask them to take 2-3 weeks, make changes, check in, see how they're doing. You want to add another thing. So we're building, and it's kind of like putting small deposits in a bank account over, time. You're going to have, a better balance than if you were to just at one time put it. You can only do so much as a provider. Most of the work is done by the client, by the patient. So finding a patient that truly is honest with their self and want to make changes. But almost every patient that I've seen is a cancer patient. At some point in our journey together will say to me, Dr. Aks, what did I do to contribute to my cancer diagnosis? And, that's a very complicated, complex, involved answer. And it takes a long time to try to, tease off the layers to try to see, what terrains in this person, terrains we refer to as circulation, inflammation, oxygenation, hormone balance, genome stability, all those things. Where is there opportunity to find issues that we can then focus and target? And what sequence do we do that? What's the most important? What do I think is the most important? Like sometimes there's stress. People come in, how many people these days have anxiety and depression? Life is full of chronic stress. So you can't always take away stress, but to learn what stress, to teach people, have them understand what stress does on the body, use nutritional therapy to improve with stress, teach them ways to handle stress, easy ways, breathing techniques, some quick mindful meditations, to help bring those stress hormones down. These are things that as an integrative oncology coach, would work with their clients on, just kind of the whole aspect of who they are.
I love that approach. I do. I love how individualized it is. Can you stress how important that self evaluation and honesty is when talking with you and kind of looking inward with how their lifestyle and their diet is?
Absolutely. So a patient is the number one key person in their care team. And I always approach patients and let them know, look, this is a partnership.
Mm-hmm.
I'm not here to dictate to you what you need to do. I'm here to help you understand as best as we can your disease process, what the standard of care treatment recommendations are and why, what to expect, what are things that we can do to help you through that aspect of your healing journey, and then support you in survivorship moving forward. So that we hopefully won't down the road have a similar experience. So learning how to live a healthier life to improve not just longevity, but health span, how long someone lives healthy, and reduce risk of recurrence or other chronic illnesses.
So I imagine there's a need to approach a lot of lifestyle issues with a lot of respect and compassion.
As a provider, relationship is very important. Trust is very important. If a patient doesn't trust their provider, they're not likely to follow the recommendations or not follow the recommendations as prescribed, make their own modifications if they don't trust what their provider is telling them. It's also important that the provider listens to the patient and honors the patient's decision. I suppose that there are times where people are making decisions that truly is not in their best interest, but it really takes a village. And as I said, the patient is the most important part. So developing that trust, and it's hard in today's health system for providers to do that because we are burdened with so much. We get this amount of time with a patient when we need this amount of time with a patient. As I said, it takes a village, so individuals can partner with other healing providers to try to get the various aspects of their care that they need for that holistic approach, that comprehensive, integrative approach.
Back to someone coming to see you, and let's say they're a mom who needs to make change, or you're recommending changes to their diet, but they have a family to cook for. So how do you work with someone like that who is trying to balance meals that everybody enjoys
Yes,
and also make the changes they need to make and incorporate baby steps, and you want to keep them from being overwhelmed?
it's not easy. I was a single mom of my triplets when they were 3 years old,
Wow.
and running a solo practice as a breast surgeon, running to 4 different hospitals, having 2 offices, and trying to keep all the balls in the air,
Yeah.
taking care of my house and my kids, and it was really, really challenging.
Mm-hmm.
But again, I would say what I did is try to start educating your kids. Kids learn by example,
Mm-hmm.
really.
Yeah.
I mean, you could talk to them till you're blue in the face, but what they're going to really retain is what they see.
Mm-hmm.
So if you allow your kids to participate, take them to the grocery store, go around the aisles, show them, talk about the foods, talk about the different color foods and why there's different colors in the foods, and the chemicals, the polyphenols that are so great for our body cell function, and engage them into letting them pick, well, what is your favorite color? Red? Oh, how about these beautiful red peppers? Or how about these purple carrots? Or these dark berries? And then make it fun. Maybe you take different, as an example I did with my kids, they take different colored fruit, berries, purple, blue, strawberries, red, and then have them taste them and see if they could taste the difference, just engaging your kids. And then I always like to do fun things with kids in the kitchen. So when it's age appropriate, to have them help you with what they can for their age. Like maybe they're not going to help chop, but maybe they can help wash and teach them about the importance of food safety and smelling food and washing, the pesticides off the food, or explaining why certain foods should be bought organic, whereas if you can't afford to buy all organic, these are the conventional foods that are a little safer, and why.
We had talked briefly about quality of supplements. What do you recommend someone look for in quality, Cynthia?
So the supplement industry is a multi-billion-dollar industry, as you probably are aware. And it's really not regulated by the FDA like pharmaceuticals are.
Mm-hmm.
So any supplement company can put a label on a bottle and say, oh, this is what's in this bottle or this jar. And it may be accurate and it may not. And there may be all sorts of fillers and other things that we don't want to ingest. So we do want to try to be mindful about looking at the bottle and looking for certifying organizations. So these are organizations that come in and into these processing places with the supplements to kind of oversee. They're independent people like USF or GMP. And then the other thing that is to familiarize yourself with some of the better reputable companies, and don't just pick the less expensive one. I understand that everything costs more these days. What I try to point out to people is that invest in your health. If you put money up front, look where you can cut back. Like say if you're a smoker and I don't know how much cigarettes cost these days, how much a year you spend on smoking. If you could take a small portion of that and apply it towards, maybe you buy one or two organic produce that you didn't buy before, and then you start adding, find where in your budget you can make some tweaks and start investing in your health with good quality nutrients, good quality food. It will pay dividends in the long term in the way that you'll have better health, you'll have fewer visits to the doctor, you'll have fewer needs for medication. You likely may not be able to take as many supplements. You'll be feeling better, maybe have a better mood. I mean, all these things. If you have a practitioner that is familiar with good quality supplement companies, many of these supplements you can only get through a practitioner. You can partner with them. But doing a deep dive, you have to do your research. It's nobody can spoon feed this to you. And you really don't learn as well if someone's just telling you. You learn better when you actually spend the time and investigate on your own.
What does it look like for someone to work with you and work with their oncologist when they're starting treatment to get really good supportive care from you and feel better during their treatment?
You want an oncologist that's open to partnering with an integrative provider and that they communicate with each other. No, that doesn't always mean that there's going to be agreement. It's just like if you're shopping around for treatment recommendations and one doctor says X, another doctor says Y, and maybe another doctor says Z. It's like, okay, what do? Who do you go with? You want some collaboration. And sometimes that's, easier said than done. But what's important is that your care team knows all the players of the team. And then there's collaboration, there's communication. And if there's a disagreement, to have, some conversation about that and include the patient in that. Like sometimes I will say to a patient, this is what I think. This is what your oncologist thinks. We can find data to support both philosophies. Let's talk about what resonates with you, because the ultimate decision is the patient's. They have to trust and believe in what intuitively is in their best interest. And if people are in tune with their intuition, that can be really huge in the outcomes of their treatment.
Clinical oncology pharmacists are really good people to work with too,
Yes.
with this. They have a deep understanding of diet, supplementation, and so on, and also when to time things with regard to treatment and supplementation. And so that's a good person for the patient to pull in as a collaborator with someone such as yourself. And I mean, I'm preaching to the choir saying that. So,
Absolutely.
And I think they have a higher comfort level or I shouldn't say higher, but a high comfort level with that as well. And I think they're becoming making themselves more comfortable with it out of necessity, because this is becoming more mainstream to take care of people wanting to take care of themselves. So what do you see as your role for someone who, say, is on maintenance therapy for a couple of years and is symptomatic, as far as being an certified oncology nutritional counselor, working with them and working with their team?
There's a lot of things that can be done. Like I said, looking at genomics. So one of the things that is now becoming more recognized is the field of pharmacogenomics. So better understanding, we talked about SNPs earlier in the podcast, better understanding, do people have certain SNPs or alterations in genes that help metabolize drugs? So there's a family class of isoenzymes called the P450 system. And many of these enzymes, they may have similar functions, but their chemical structure is a little different. And so they are used to metabolize some drugs. As an example, with tamoxifen. Tamoxifen is a medication that's quite popular. It's age old for breast cancer, and it's used currently for premenopausal women with hormone positive breast cancer. And it's a medication that historically was used after treatment to try to prevent recurrence, but now we also give it as a initial step if it's indicated. But in any way, some people have an alteration in one of their a SNP in one of their P450 enzymes that it doesn't work well. So, people develop resistance to the tamoxifen because it's not being metabolized and utilized properly. So one of the things is to better understand, what drug is this person taking? Why are they still having symptoms that, may be out of the norm? And trying to better understand that instead of just trying something else. It's like, because that something else may also not be metabolized. Do you understand what I'm trying to say?
So I imagine that the deep dives you do with people and the long conversations you have with them, a lot of times I bet you do find the roots of those matters.
Well, I can.
Yeah.
But, the challenge is, as is typical, is cost.
Yeah.
Because, to do that deep dive, there's specialty labs
Yeah.
that aren't done as a standard profile. I mean, even some of the nutritional labs that I can recommend and have drop shipped to a patient's home is not something that their primary doctor, even their oncologist, can order at their hospital, and not necessarily something their insurance will cover, even with the right diagnosis code, the right ICD-9 code. So there can be out-of-pocket costs in order to do that some patients may not be able to afford. Or, you can encourage them, well, let's see where you might be able to create a budget and work towards putting a little in to then afford that test to give us more information. The more information we have about someone's uniqueness biologically, physiologically, the better able we're going to be successful in their healing journey, both physically, mentally, emotionally, spiritually.
Is there anything that you'd like to share that you haven't shared yet?
Yes, I would like
Please.
to say, so just try to, we're talking about simple things that people can do.
Yes.
I'm a big proponent of people developing body awareness, and that stems from my yoga therapy training, likely. Um, I have a lot of expressions in my practice, and one of them is listen to the whispers of your body so you don't have to hear it scream. So develop body awareness. Start paying attention. We talk about nutrition today. Start paying attention to when you eat something, how does it make you feel? Whether it's physical or emotional. How does it make you feel? There's so many food sensitivities that people have developed that they may not be aware of.
Mm-hmm.
And, one of the top ones is gluten.
Yeah.
Oh my gosh, I had an experience with gluten several years ago. I couldn't figure out why. A pretty healthy person, I thought. I exercise, I eat healthy, but I continued to gain weight and I felt bloated and I just with brain fog and fatigue is like, what is going on here? And so I finally, after seeing many different providers, one of the things we did was an extensive food sensitivity test. And I found out that I was sensitive to gluten, corn, cane sugar, dairy. I mean, fortunately not nuts, but a lot of stuff. And it's like, wow, when did that happen? Well, it's probably the way our food is processed and all the chemicals. But once I started eliminating, it was not easy, let me tell you. For a whole year, I was very strict. And to this day, I've maintained a 20-pound weight loss. I feel so much better. But I started noticing that when I would cheat, I'd get my symptom, my arthritis would flare up. And, then I had to make a choice. Okay, Sin, yeah, you want that food. It's so yummy. You're craving it. In 24 to 36 or so hours, you're going to pay for it. So it's a conscious choice. Healing is a conscious decision. Healing comes from within. So your care team can diagnose, treat, but the healing process is really the ownership of the patient with the support and the resources and the education of your care team. But it all starts with the patient. So making conscious decisions is so important, and being honest with yourself. So I would say one of the simplest steps that people can take to make a difference in their overall wellness right this minute is to start developing body awareness and paying attention to what you're eating and how you're feeling, both physically, emotionally, and start connecting the dots. But then don't ignore that. Make a plan of action. Otherwise, why even bother?
Baby steps. Baby steps. Don't overwhelm yourself. Baby steps.
Yes.
This has been so helpful and it's been so interesting. And I can't wait to have you back and learn more.
Thank you, Jill. It's been my pleasure.
It's been my pleasure. Thank you so much, Cynthia. Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guest, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. And for anybody that you have invited to join us, please reach out if you would like to be a sponsor. We would welcome you. Thank you.